the points that you were raising pertain to policy and opportunities, healthcare systems, incentives, and annual wellness visits. Why bring it all together? Because we've been talking about uh, cohorts, registries, primary care, and it comes back to policy and economics. Your your dime.
Okay, thanks, Barry. Well, I'm going to take us all back up about 1,000 feet or so from the kind of key insights that Van told us about with her codes and registries and Monique's important descriptions about the kind of travails of getting access to treatment and take us to our population, US population. So I run a research program on dementia funded by the National Institutes on Aging. And my colleagues and I, what we do is use very large population data sets that are nationally representative of middle and older age adults. And we kind of study this whole dynamic from the social and economic risk factors for dementia to the effects of this and our systems and policies on detection and diagnosis, treatment, care, all the way through what are the costs of dementia to individuals, families, society. And our purpose of doing this at the population level is for what you referred to, Barry, as kind of finding these policy and healthcare system opportunities to improve everything along that pathway. So I'm an economist. I'm going to start with some numbers for us. So we just recently finished an estimate of the prevalence of dementia in the US, which in 2025 was 5.6 million people. And what we did with these data, it's national representative data on these individuals, is then we linked it to their healthcare claims records. So these are primarily Medicare beneficiaries. And these claims records of their healthcare, while used for billing purposes, they have all the diagnoses the individuals have received, all the healthcare use that they have used. And so we can look at who has dementia and who is diagnosed with dementia. And what we have found is there's about 20% of the US population that are undiagnosed. And not surprising to this group here, it's much higher for certain social and demographic groups. So higher for Black persons, Hispanic persons, low educated persons, persons in rural areas. But even more important for kind of linking us back to what Van was talking about with clinical trials and Monique was talking about with treatments, what we found in a recent study was not only undiagnosed, but late diagnoses. So while about 20% of white persons were diagnosed with dementia at very early stages, early symptoms of mild cognitive impairment, that was about half that rate for Black persons and Hispanic persons. So they're not being diagnosed, the whole population is not being diagnosed at early stages if they're diagnosed at all. And so why is this important? I'm just going to talk about a few topics that we've kind of touched on. The first is clinical trials. So many clinical trials want people at early stage of disease. We need representation in clinical trials in order to build real world evidence on progression of dementia and disease, on the effectiveness and safety of our new treatments, and the validity of our detection tools, our blood-based biomarkers, and all these new um, uh, detection devices that are coming onto the market. We also know from Monique that and from your introduction, Barry, that in order to be eligible to receive these new disease-modifying therapies, those therapies that are going to slow an individual's cognitive decline, you have to be at early stages of disease. I want to touch on just kind of one more point and then an important barrier that Barry, you mentioned. So another point is that these underdiagnoses and these late diagnoses are costly. They're costly to the individuals and they're costly to their families and they're costly to our healthcare system, Medicare and Medicaid. So we know from many studies that being undiagnosed or late diagnosed leads to avoidable hospitalizations, a lot more emergency department use, just not to mention the kind of impact on quality of life of individuals and their families.